So I want to have it, and want to look at polyostotic what lesions. So when you say a lesion is monostotic, there's a tumor growth, and the tumor growth is one place. But when you're talking about polyostotic, of course, it's a monostotic lesion. That's a tumor growth is becoming malignant. So the cancer is spreading from one place to another place. So polyostotic. We look at special ones as related to orthopedics. Things like fibrous dysplasia, histiocytosis, multiple exostosis, and the Paget disease. Okay, so all of them, this is a fibrous dysplasia. Most of these disease conditions, if you see it, you will not see a black man's picture there. That's one thing. As I came into medical school, I used to thank God I'm an African. Some disease condition, guy, you won't see African pictures there. It affects only white people. So you see, this is I think this is histiocytosis, though. It has some characteristic skin issues. Then multiple exostosis, guy, a lot of issues on your bones. This one is white man issue, don't worry. Okay, then Paget's disease. Paget's disease could actually affect all Africans too. Okay, so let's look at them one by one. And so the first one we're looking at is the fibrous dysplasia. So it's just a developmental anomaly where the normal bone is replaced by fibrous tissues. Forms, you have the monostotic one, you have the it's affecting just a single part of the bone. They also have the polyostotic ones. So radiographic features, you see a ground glass appearance, expansible lesions with cortical thinning, the Shepherd crook deformity of the femur. Okay, so clinical, they are feeling pain, they are deformed, how do they call it, everything is weak. Okay, they're prone to fracture. Then histiocytosis. So histiocytosis is just proliferation of Langerhans cells causing lytic bone lesions. So forms, you have the eosinophilic granuloma, okay, Hand-Schüller-Christian disease, the Letterer-Siwe disease, all of them are there. Then radiographic features is you have punched out Lytic lesions without sclerotic rim. It's common in the skull, in the rib, the pelvis, and the long bones. Okay, then multiple exostosis. So multiple exostosis is just genetic disorder. It causes a lot of osteochondromas. So radiographic features is sessile or pedunculated bony projections. Okay, when they say pedunculated, the thing is actually big up and it's having like a stalk attached. Do you understand? So that's what we got. Then often bilateral, symmetrical. Okay, so clinical, you have limb deformities, restricted motion, and short stature. How about the Paget's disease? It's also known as the ostitis deformans. Okay, so disorders of bone remodeling, mixed lytic and sclerotic changes, cotton wool appearance in the skull, bowing up long bones, cortical thickening. So there's a lot of bone pains, deformities, fractures. There's increased risk of osteosarcomas, okay, and may cause secondary arthritis due to deformities. All right, so that's it for these lesions that could actually appear at different parts of the skull, of the bones,